Okay, that's okay. Thank you for being here. And
the men are running through the doors.
Yeah, they are, man. They're all going to be late, right?
I couldn't refuse.
Yeah. So, how many of you guys were here last time when I did the part one? Okay, you guys weren't. Okay. So, I've got a question for you guys who were here. 2 questions. I just want to see how much you remember. What was the primary backup organ for the ovaries during menopause?
The kidney?
You're close, but that's not it.
I was going to say the adrenals.
The adrenals, that's right.
Oh.
The adrenals, the adrenal glands. That's your backup organ for the ovaries. And it's your adrenals that make all your sex hormones in addition to your ovaries. So what would happen then if you're going through menopause and your adrenals are not working very well?
Well, I know the answer to that one. You're very tired and worn down and don't have a ton of energy.
Right. So it's going to be a lot harder.
Yes.
Yeah, it's going to be a lot harder to go through menopause. Okay. So what hurts the adrenals? What is some of the things that really cause the adrenals to not work right, or to down regulate, or to crash? What are the things that anybody remember?
Hormone imbalance?
Okay, but what causes that hormone imbalance? What causes, if the adrenals are your backup system and they're making progesterone and estrogen and testosterone, but the adrenals aren't working right, what causes that?
Could it be your thyroid?
Thyroid could be off. Usually it's the adrenals that pull the thyroid down. That's an okay answer, but
Stress.
it isn't quite the right one.
Stress.
What?
Stress.
Stress, yeah. Any kind
They're
of stress.
listening to me give the answer.
What?
I said,
No,
they're listening
I
to
knew
me.
I knew the adrenals one because
Okay.
I struggled with that.
You need to whisper louder, Carmen, so we
Okay.
all can hear it, okay? So, yeah, okay.
Too many things I've answered with a diet lately.
Yeah, stress. Okay, so there's lots of different stressors. There's sugar, there's diet, there's emotional stress, there's all kinds of stress. Okay, so stress pulls them down. So here's a second question I have for you. What were the 2 unnatural ways, some of the unnatural things that throw a woman into menopause?
Hysterectomy.
Hysterectomy would be one. Yeah, that's the most obvious. Just take out the organs and you're, okay, what else?
Would it be synthetic hormones? Like putting yourself on? I can't remember. I know you talked about it. I just can't remember what you talked about.
Yeah, it wasn't synthetic hormones. Synthetic hormones aren't the, I don't like them very much. I'm not saying they should never be used. I don't like them very much.
Yeah.
Okay, chemotherapy and radiation were the 2.
Now I remember that.
2 of the things that can throw a woman into menopause. Okay, so this time around, last time I talked about what it is, how it works. Now we're going to talk about what are some natural things we can do to support menopause to really help a woman go through that in a more natural, holistic way. So one would be, the first thing that I would look at is chaste tree. Chaste tree is an herb that has a direct effect on the pituitary signaling, so it supports the hypothalamic pituitary axis. So chaste tree helps the pituitary signal the ovaries and the adrenals to help make more hormone. And it also, chaste tree also helps the estrogen progesterone balance. So it helps provide support for all aspects of female hormone cycle. Normally, I would start out, hey Terry, yeah, come on in.
Hey, Paul.
I would start out, I would more likely use Chase Tree on a cycling female, although it can be used pretty well with menopause, okay? So Chase Tree is a good place to start. Number one is we want to look at dietary modifications. So if somebody's in perimenopause and they're having a lot of issues, hormonal issues, but they're eating a lot of sugar, processed food, processed fat, meaning like margarine, hydrogenated vegetable oil, a lot of white, brominated white flour, which kills your thyroid. We need to change that. You cannot have a healthy body, healthy hormone system if you're eating a lousy diet. Another thing is we want to support digestion. So even if you're eating a good diet, but you're not digesting your food very well because you don't have the hydrochloric acid and the pancreatic enzymes to digest the food, which I see, by the way, in a lot of patients, then we'd use Digest Forte or digestive bitters. And then we want to support the adrenal glands.
How would you know, just from a standpoint of actual indicators, like without a blood test?
For
the digestive issue.
Oh, you can, there's a couple of little clinical tests I can do in my office.
Would you notice it as a person though in your daily life if you were having a digestive issue?
Sure you could. You're bloating, you're having reflux, your bowel movement, you're not pooping. I mean, those are all things that would tell you that's off. Now, that doesn't tell you exactly what's off.
Okay.
It just tells you there's something not right. Okay. So I just did an exam this afternoon on a 21-year-old co-ed, and I asked her. She asked me. She said she has a particular problem that I would consider an autoimmune issue. That was even the main reason she came in. So the first thing I asked her, what's your digestion like? Because there's a definite correlation between gut issues, autoimmune issues. I said, are you eliminating? Okay, yeah. She said, I go about every other day. Well, for a 21-year-old, it's not what's supposed to happen. Not supposed to happen for anybody. So we need to fix that. Okay. So adrenals. Let's talk about adrenals. Adrenals may be the issue, it may not be the issue. The herb ashwagandha is a key herb for adrenal glands. Adrenal tonic, which contains ashwagandha, can be a very good formula, but these two don't work on everybody. So I have like about 6 adrenal formulas that I try and match that formula with the person. Maintaining normal blood sugar is very important. What happens when blood sugar goes up in anybody, but in a woman, anybody? What happens when the blood sugar starts to go up? What are some of the consequences of that?
Dizzy. They get dizzy.
They may, but I see quite a few people with elevated blood sugar that don't have dizziness. But it can if it's too high.
It does on me.
Yeah. Okay. It may happen with you.
Yeah.
But what are some of the like hormonal consequences of that elevated blood sugar? What's the other hormone that goes up when blood sugar goes up? Blood sugar's high, it stays high. What's the other hormone that's high? Remember? Insulin. So when insulin is high, that's a sign of inflammation, okay? And it's a sign that the body's loading up fat cells with fat. So when your body's inflamed, it can't work right. It just has a hard time working the way it should. So gymnema, key herb for lowering insulin. Trace minerals are important, essential fatty acid, multivitamin, food-based multivitamin. So anytime your insulin levels are high, your body stores fat, and you're dealing with inflammation, body's not going to work right. Okay, so here's some support for adrenals. So here's all the foods that support adrenals. So imagine that they're all whole foods: fruits, vegetables, nuts, kidneys, figs, all the support adrenals. So you have a nice salad, put kale on it, some walnuts, maybe throw in some avocados. You're supporting your adrenals, okay? Yams. Now, at our house, we eat a lot of sweet potatoes at our house. And so it's a great support for adrenals. Here's some herbs that we use for adrenals: Romania, Eulethro, this is basically dandelion root, okay? That's the one that works for me of all of these, is dandelion root. Ashwagandha, licorice, rhodiola, these are all good for adrenals, okay? But again, you can eat a healthy diet, and if you look in here, 3 of these are nuts: almonds, Brazil nuts, and walnuts, okay? So all good for adrenals. Now, liver health is really, really important to maintain optimal hormone levels. Why is that? Why is the liver important?
It's the cleanser of the body. It detoxes your body.
That's right. It's exactly right. It does do that. But what happens if it's not doing that very well?
Then, you go for it.
Terry?
It doesn't store sugar. It's not working right.
Well, it's not working right, and you want the liver to store some glycogen, which is
Right.
sugar cooked
The
together.
liver releases.
Right. It releases it when it needs it.
Slow, yeah.
But the liver also has to detoxify excess hormones in the body. And your body creates, anytime your body creates hormones and it needs to get rid of them, which it does, the liver is the one that detoxifies those hormones. So what happens is, if the liver's not working right, those hormones build up over time. Then you get estrogen dominance and all kinds of issues. So like in a young female and a cycling female, if they're having a lot of menstrual issues, and I realize we're talking about menopause here, first thing I'll do is put them on a purification cleanse, get their liver working right. And a lot of times that's all you have to do, and their hormones just snap back. So, but it's also important during menopause, because you want your body working as best as it can. Weight and exercise. So focusing on a healthy weight is important. Adrenal function. Sometimes we need to test and find out what's really going on. And probably my favorite test of anything for both premenopausal, but especially postmenopausal women, is the bone health panel, because that tells me, look, it gives me a shot at their adrenal glands, how their adrenal glands are working, estrogen, progesterone, testosterone, bone health, and then follicle stimulating hormone. It's a great test for a good overview of what's going on with hormones. So testing is not always necessary. If you just fix diet, sometimes that works. A lot of times that works. Just detoxifying the liver, exercise, just doing some basic things. You don't always have to run an expensive test. I had a woman come into me, and I've told this story before. It's probably a year ago, and I said, she had some issues. She was probably about 30, 35, and I said, here's a test we can run, or, you can try the diet. You can try fixing your diet. Here's the things you need to fix. You can try that first. She said, I want to do that first. I said, great, do it. So I didn't see her again. Forgot all about her. About 3 months after that, 4 months, she left a message on my answering machine. She said, I just want you to know that I changed my diet and all my problems went away. That's great, That's the best way to do it. So key herbs to consider. Again, wild yam complex. And by the way, we have that on sale for 25% off. both large and small. Go to her black cohash. It's part of wild yam complex. Tribulus, great product for hot flashes. There's another product I have called Feminine Advantage, which is good for hot flashes and menopausal support. So any of these work really well. So what about hot flashes? What causes those? Well, it's when your estrogen decreases and then your follicle stimulating hormone increases because it's trying to increase estrogen. That influences the part of the brain called the hypothalamus and the limbic system, which is your emotional part of your emotional brain. And when estrogen starts to fluctuate, the hypothalamus actually helps control body temperature. So that's why you get hot flashes. Stress and sugar fluctuations can be triggers. So if you're getting hot flashes, you definitely don't want to be on a high sugar diet. Excess cortisol production can cause increase in the body's core temperature. What's the gland that produces cortisol? Adrenals. What would cause the adrenals to produce too much cortisol? Stress. Okay, yeah. Stress.
I'm shaking my head before you even said anything.
Yeah, okay. So causes of hot flashes, and here they are. Look at it. Refined carbohydrate intake, increased sugar consumption, poor liver function, smoking. So all of these things, a lot of these things can be fixed without testing. I mean, I can tell if somebody's has hypochlorhydria by just doing a simple test in my office without doing any blood work at all. So those are some things that can cause hot flashes. And what do we have a lot of this? We have a lot of this in our culture. I mean, you just walk around a grocery store and look at what people put in their cart, and you can figure, they're not very healthy, most of them. Hypothalamus is a key player in all of this. So what do you do with hypothalamus support? We have a product called Hypothalamics, which is really provides a lot of support for hypothalamus. Estrogen precursors like this, wild yam complex, and chase tree support that really well. In wild yam complex, what are the chemicals in wild yam that help? Well, there's steroidal saponins which interact with the hypothalamic estrogen receptors, which help with hot flashes. They can allay the effects of estrogen withdrawal. Wild yam really works good for that. So, in fact, in some far East Pacific countries like New Guinea, where they eat a lot of wild yam, a lot of the women there use that for birth control, actually. And they've got it down to, they know how much to eat and all of that in New Guinea, and I've seen that's very interesting. Wild yam complex, which is contains all of these. So this is all really good for not only the allaying hot flashes, but also for some of the depression that can come along with menopause. So provides support, wild yam complex, hot flashes, insomnia, mood fluctuations, fatigue. All of this is supported in wild yam complex. So black cohosh, that's part of wild yam complex. Very good for mood, sleeplessness, anxiety, night sweats. A lot of studies on black cohosh. Has a positive effect on dopamine and serotonin. Now I don't have the liquid black cohosh here, but it's black cohosh is part of wild yam. A good, just general tonic for any menopausal woman. Sage, really good for hot flashes, really cools. It's a cooling type herb. Also in wild yam complex. And these are, you know, you do not want to exceed the dosages on the bottle, okay? Because if you start getting too much sage and too much black cohosh, your body's going to react in a negative way. So you want to take what is recommended. You don't want to get too much of that. Tribulus, another product that I really, really like a lot. Tribulus is really, really good for modulating estrogen, testosterone in the body. So it's good for men and women. Really good for hot flashes. Really safe. And you only get it from Eastern Europe. The only Tribulus that's really good, you have to get it from Eastern Europe, or that has to be sourced from there. So Tribulus helps relieve menopausal symptoms, but if you're not in menopause, it helps boost fertility and libido. You can combine it with wild yam for really good results. Again, the phytochemicals in Tribulus bind to the hypothalamic estrogen receptors to help with the temperature fluctuations. Really good for any type of female or male hormone dysfunction. Works for both men and women. Vaginal dryness. So decreasing estrogen causes a lot of that. This symptom is an expression of hormonal dysfunction. Black cohosh can help with that. But there's also vaginal suppositories, which I've seen. We have these here. They work really, really well. And so these are estriol creams. Estriol is a very weak form of estrogen, so you're not going to get a strong estrogen reaction in your body. And you know, we can go over this if you know somebody that wants to use it or you want to use it. We can go over how that works. Gotu kola, very, very good for supporting tissue integrity. Gotu kola is called facelift in a bottle. Okay, helps any body tissue heal, skin, bones. Good for healthy skin during menopause, especially the vaginal tissues. Wheat germ oil, really good for hair, skin, and nail support. Very rich in vitamin E, and very, very good. Your body makes hormones out of wheat germ oil. So I had a young patient. She was 17 or 18. You know, her cycles were off, and she's pretty healthy. She worked out, ate a really healthy diet, and all I did was give her wheat germ oil, and that worked really well for her because then her body could make what it needed. Okay, this is vaginal dryness recap. So we've already talked about all of the things that will help that. What about depression during menopause? What's the medical solution for depression during menopause?
Antidepressants?
Antidepressants, yeah. That's what they give, you know. And if a lot of women that come in that are struggling with menopause, they get antidepressants. Is menopause a Zoloft deficiency? No. No, it's not. It's not an antidepressant deficiency. So that would be the last thing that I would look at.
Doesn't ashwagandha help with that a little bit though too?
It can. Ashwagandha really helps boost adrenal functions. But there's some other things that will really help with that. St. John's wort, really, really good for menopausal depression. And that is in wild yam complex, is one of the things in there. Now, what else does St. John's wort do that's really, really good? Do you guys know?
Oh, you
You said this at one, I
Sleep?
forgot.
What?
Does it help you sleep?
It
Go to
might.
sleep?
It might, but that's not. That would be like kava would be better for that.
You said this in one of your other teachings. I
Okay,
can't
very
remember.
antiviral.
Yeah.
St. John's wort is powerfully antiviral. So, if you got like COVID, you could take St. John's wort. Now, there's other things I would give for COVID in addition to that. Very, very antiviral, very good for menopausal depression. Again, wild yam complex has it in. Kava forte, really good for anxiety and sleep. Although stimulating the vagus nerve with the stem pod that I have is really also good for anxiety. So we use quite a bit of St. John's wort here. Research strongly supports use for mild to moderate depression. And you can take it when you're on antidepressants. Like if you want to move away from antidepressants, you can start taking them while you're on there and it's not going to hurt. This is going to be a little bit of a hard question. Research shows that something else really works well for mild to moderate depression. Does anybody know what that is? Nobody knows. Exercise.
I was gonna say that.
Yeah. There's a
I didn't
great,
think about that.
I thought, no.
great
that's
study
funny.
out of
Yeah.
Duke University that came out, boy, I don't know, I think it was in the 90s, where they looked at exercise and antidepressants. And they did it over, I think it was over 3 to 4 months. And it showed that for mild to moderate depression, exercise is way better than antidepressants, regular exercise.
Doesn't it help the balance of the serotonin, melatonin?
Sure, it releases, it helps serotonin, helps dopamine, all of that is really good. And where is most of the serotonin and dopamine in your body made? Anybody know? Okay.
No, I don't know that one.
Carmen can't wait to say
no,
it.
I'm not saying a word because I already know.
Yeah,
Hormones are not
it's in
meant
your
for a
gut.
Yep.
It's in your GI tract.
Oh, you probably
Okay.
have said that.
And so if that's the case, so let's just put some things together. Most of the serotonin and dopamine is made in your GI tract. And exercise helps with depression, which means that exercise would help get your dopamine and serotonin to your brain. Then what does that say about exercise and GI function?
They work together.
Yeah, it's really good for GI function. Right. That's exactly right. Okay.
Helps peristalsis.
Yeah, that's exactly right. That's good. That's right. It does. So exercise is really, really good for GI function. It's really, really good for depression and anxiety because there's actually biochemical things that happen to the body because of that. It's really good for women in menopause too, because it really helps that aspect of menopause, which is the that depression part that some of them struggle with.
What about when after a woman has a baby and she's really depressed and then it turns
You talk
out she
about
doesn't wanna
postpartum depression. Okay.
take- Okay.
It's a great question. That's usually low adrenal function. She went into pregnancy, had the baby, and has lousy adrenal function. And that's what causes a lot of that. So I would want to put that, I would want to test that person's adrenals, then build them up with probably nutrition, good supplements to help the adrenals. So with St. John's wort, you should see results before 4 to 6 weeks. And if you're not seeing results by then you're probably not going to. Okay. Kava. I use a lot of kava in the office. Really good with sleep issues and anxiety. Kava really helps with that. Helps with appetite, concentration, fatigue. We use it primarily for anxiety and sleep in the office. Those are the two things it really helps with. Now, again, I started using neurostimulation for that in the office, and I even like that. I like that a lot because you're hitting so many parts of the body that, you know, maybe taking kava may not hit. So I like that probably a little better. But I mean, you know, if you're going on a trip and you know you're not sleeping well, you take kava with you, and it works really well. Let's see. Okay, this is ashwagandha complex we use. Okay, so that's all I have today, and it's 7. Any questions about anything I've gone over?
Good information.
Boy, everything's clear as mud, huh?
I have a question
Okay.
about this wild sweet potato.
Wild yam complex?
Yeah, wild yam.
Yeah.
Why just that? Doesn't regular yams have some therapeutic effect for
Wild yam only.
only wild yam?
Only the wild yam, yeah.
And it's
Regular
grown
yam.
like in Indochina in that area?
It's I don't know where they're sourcing their wild yam from.
It's not from Bulgaria?
No, that's tribulus.
Right.
Tribulus. So I'd have to look. That'd be easy for me to find out.
Okay.
But I don't know where they source that from. I'm glad that regular yams
were
aren't full
saying
of
the
estrogen
women,
because
yeah.
I eat a lot of them. You know?
Cultural women were
$1
eating the
million.
wild yam, and I go, where?
Yeah.
What countries?
I don't know, Terry. That's a great question.
I got you finally.
You got me. You definitely got me on that one. I need to find that out. One phone call and I could find out real easy where they source it
Just
from.
asking to find out, yeah.
So yeah.
That
So
amazes me, you know.
yeah.
Sounds like a pretty good root.
Yeah. I mean,
You know, I eat beets and I eat, you know, onions and all kinds of root type things, but I don't eat that. I don't eat that.
yeah. Well, I don't eat wild yam either. I eat, you know,
I eat
domesticated
yams,
yam.
but I
Yeah.
don't eat, you know, the wild
But when you look at everything I talked about tonight, it's a plant.
everything. Yeah,
Everything is sourced from a plant.
yeah. You can call it a tree nut, but you can also call it a plant. And as long as you eat a lot of vegetables, a variety of vegetables, that should kind of,
It helps a lot.
it helps.
Unless you're really deficient in some things, then you need to supplement.
Now you got to
And-
concentrate on it.
yeah, and I, you know, there's things I need to supplement. I supplement regularly. So,
The information's really super good because I was lacking in that area because there's all kinds of things that people